New Jersey. He just did his first smile lock, mandibular arch. Dr. Goldstein, can you tell us what's your experience? You've done a bunch of cases with CHROME, and this is your first smile lock case?
Yes.
How did that go?
Well, great. You know, a couple of unknowns about the case with regards to the multi-units are a little different than what I'm familiar with. The actual smile locks themselves, the little bit of a difference with the 30-degree multi-units. We weren't sure if they were seated. But at the end of the day, you know, the multi-units are a little bit more robust than BioHorizons. So as far as, you know, suturing goes, most of the tissue was out of the way. And then, you know, once the PMMA was converted, it was just snap. Now, of course, I don't miss the Teflon tape. I don't miss the Telio in the holes, et cetera, et cetera. So it really was, it's great. It's a huge upgrade. And of course, because Thomas was here, I think we did this in like two and a half hours, and then he took over, and then a little bit on occlusion, but I've had some of these cases go, when I'm doing the conversion, 4 to 5 hours. So honestly, don't feel that tired right now.
Excellent.
But I still won't do 2 arches at once.
Excellent. Listen, thank you for having us today. Thank you for doing Smile Lock and CHROME with Roe. We appreciate your business.
You're welcome.
We appreciate it.
Thank you.